Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and KUAR FM 89.
Hello again, everyone, and thanks very much for joining us. Up top tonight, it's the multi-billion-dollar health care program for the low income, the state and federal combine we know as Medicaid. Big changes are at hand. The federal policy that essentially protected enrollment during the COVID pandemic has expired, exposing tens of millions of Americans and tens of thousands of Arkansans, scores of thousands, to perhaps the loss of medical insurance coverage and the special financial aid to health care institutions, providers, that's at an end as well. Also, the Sanders administration is asking Washington's permission to impose a work or volunteerism requirement on Medicaid's expanded coverage enrollees. So, much to cover with Kristi Putnam, the new Secretary of the State Department of Human Services, and Janet Mann, the Arkansas Medicaid Director. To both of you, we thank you very much for coming on board. If I can, let's begin with the Sanders administration's work requirement that it's asking permission from Washington to impose. What guarantees do we have? What makes us believe that it can work, that it will be successful?
Well, we are looking at this as a workforce development component to Medicaid as a way to really connect people with better access to opportunities in conjunction with our workforce services statewide, working with community organizations who have programs in place for training programs, volunteer programs, all of the kinds of workforce supports that will help individuals who may not know that an opportunity exists out there connect to those resources and move not just into a job, but a career. We're really looking at this as an economic stability initiative.
But one criticism of the approach is that it is being used as an economic incentive when it is not designed to. Medicaid isn't designed to do that. It's designed to provide health care. Your response?
So our approach is to give the opportunities for additional training, volunteerism to our beneficiaries to help them seek additional opportunities. So while it is an economic and workforce development, it also gives them some career and success coaching to help with their health care. And it's voluntary, so they will not be penalized if they choose not to participate.
Well, to what extent, if any, is the waiver being driven by fiscal incentives other than health care? For example, the administration's plan for public education, for expanded prisons, criminal justice reform, and also for tax cuts. Is that a driving factor?
It's not. The driving factor from a fiscal perspective is really on the employers across the state who are in need of a number of highly skilled individuals to come to work in their businesses. So that's the fiscal incentive. It's not on the state side as much as it is on the employer and business side. What
kind of outreach are you going to do?
Outreach will vary, and we will seek partners across the state with our sister agencies. We will also be working with other advocate agencies and organizations in the business community to promote this. I think some of the lessons that we've learned from other outreach campaigns is the more we communicate, the better. So it will be within state government and out of government with our partners and our providers and our beneficiaries.
The qualified health plans already, as part of their programming, the waiver was approved to allow them to provide economic incentives for their participants and connections to these kinds of resources. So we will continue to lean on them and ask them to take further responsibility. It does benefit them to do so. They have an interest in this because when individuals move out of the Medicaid portion of a qualified health plan, they can move into their commercial side, which is offered on the federal marketplace and which is actually sometimes a richer benefit, and it's an enhanced payment to providers.
Under the plan, as we understand it, they're going to get medical coverage provided they re-enroll. They're going to get coverage anyway. But is the loss of the expanded coverage and the revision to traditional Medicaid, is that going to be incentive enough?
We think it will be a good incentive because staying in the qualified health plan or moving to a different type of coverage on the federal marketplace, but keeping their same health plan or same insurer will ensure continuity of care and continue that incentive to broaden their horizons and seek additional training in classes.
We're also looking at simply less Medicaid spending, are we not?
Yes, the answer is if we have individuals who move out of Medicaid coverage because they find employment and have employer-covered insurance, then that would be a reduction to the Medicaid expenditure by those individuals who are successfully moving into employer-sponsored insurance.
Well, across the country, millions of Americans are going to lose coverage, Medicaid coverage, because that federal rule that prohibited dropping them during the pandemic, dropping them from Medicaid, expires at midnight on March 31st. DHS wants to encourage everyone who is on the program, either the extended program or traditional Medicaid, to make sure that they are still enrolled, check their eligibility. Do we have an estimate of the likely Arkansas fall off in enrollment?
So national estimates are 15 to 30% of the fee-for-service population could lose their eligibility in the redetermination process. We have been very cautious about applying hard numbers to that because until we start disenrolling, we really don't know how that will apply to Arkansas. And we do estimate approximately 50,000 of the Our Home participants could move to other coverage, either on the federal marketplace or employee-sponsored health insurance.
There is some concern among rural hospitals, our understanding is, that may be already on the fiscal edge, that the impact could be absolutely ruinous to them. Your response?
There's no doubt about that. That has been in the press and that has been widely discussed. Medicaid is approximately a third of the payer source. You also have Medicare and commercial insurance. So while there is concern and we are trying to address it from the Medicaid portion, I think it's an overall concern for the state to work with those hospitals and seek ways to do more with less. And Medicaid has a portion of that responsibility.
Do you see I understand there are some rumblings, to quote a source, there are some rumblings about possibly the state moving to managed care through Medicaid. Is that on the horizon? Do you see that in the foreseeable future?
No, sir. I think we are a new administration and we are reviewing and looking at all of the programs within the Medicaid healthcare delivery system. And as I have been telling providers and beneficiaries and other interested parties, we are looking at everything. Everything is on the table. Nothing's been ruled in and nothing has been ruled out.
As of April 1st, anyway, there are some reductions, and Arkansans need to understand that.
There will be the first wave of people who are no longer eligible to remain on Medicaid will begin rolling off on April 1st.
Mm-hmm. Yes, sir. And we are doing our regular redeterminations, and then the extended population, we will spend the next 6 months redetermining all of the Arkansans on Medicaid, which is approximately 1.15 million Arkansans today. That number changes every day, but we will do that over the next 6 months. We are doing a lot of communication and working with our providers and our beneficiaries to help them do that redetermination.
All right, the recipients that are either now on traditional Medicaid or in the expanded pool, what is your message to them? What do they need to know, like right now?
Right now, you're going to be getting mail that says, please redetermine, please send in your information. We need them to either call or respond in kind with the email. And if you have not updated your information, please do so either through your local office or through the mail.
Yeah, but that underscores the need for outreach, does it not? An extensive outreach. A great many people probably do not know that they are losing eligibility or are in danger of losing it imminently.
Well, we have spent a great deal amount of time working on our unwinding plan. Over the past year, the staff at DHS have developed a pretty detailed unwinding plan that has a large outreach component to it with our beneficiaries, with our providers, with paid advertising, with social media. We've even put up digital bulletin boards in some of the doctors' offices to try to get the message out in addition to phone call and contact information, and then the mailings at 120 days or 90 days before redetermination. So we are looking at all and any outlets to communicate redetermination is coming and it is here.
So outreach really started before the end of 2022.
Mhm.
And it's called Renew Arkansas, and it's been an extensive outreach campaign. To your point, you're absolutely right. And our team has been engaged in the Renew Arkansas campaign since before the end of the year.
But that is only beginning. The outreach is really, you're saying, only beginning.
No, the outreach has been ongoing to let people know that they need to make sure their information is correct in the system, that their address is correct, that they have read the notices. If they don't understand something, to go into one of their offices to meet with someone in DHS. That has been ongoing. The additional outreach at this point is letting people know that the first wave of possible ineligible periods is coming up April 1st.
We have to end it there. Ms. Putnam, Ms. Mann, thank you very much for being with us. We're simply out of time. Please come back soon. We'd like an update.
Thank you very much. We look forward to it.
All right, good. Thank you. And we'll be back. And we are back. Gambling on thoroughbreds and greyhounds for a century or longer. It was allowed by the Arkansas Constitution. Then came a state lottery, followed by casinos. 3 are up and running. And now, under the aegis of those 3, online wagering. Benefits to the expansion of gambling? Sure. Tax revenues, college scholarships, jobs, vendors, but liabilities as well, as state government recognized by creating a hotline for Arkansans whose wagering has become an addiction, for whom gambling is out of control. Joining us now, Vena Schexnayder, president of the State Problem Gambling Council, and Dr. Buster Lackey, a licensed counselor who leads the Arkansas chapter of the National Alliance on Mental Illness. We also would ask let the audience know that we reached out to 2 of the Arkansas casinos to seek a representative here, and we were unable to secure anyone in time for the broadcast. But thank you both very much for coming in. March Madness, almost over, but April Madness is right here. By Monday night, there will be a new national champion. The tournament is the biggest sporting event since online gambling began in Arkansas. Are we seeing a surge in wagering?
We are seeing a surge, and exactly why we have Problem Gambling Month, Awareness Month, for the month of March to accompany March Madness, to bring and create that additional awareness. We've seen an increase in calls over the years from the past data, with the Arkansas Problem Gambling Council starting to take on more of those calls. Even within the last month or so, we've seen about 800 calls, which is another 20% increase than previous months.
You're up a fifth, in other words.
Yes.
Do you expect that to continue?
I do expect it to continue with the insurgence of sports betting and the digital gaming that is also a part of Arkansas's now.
Dr. Lackey?
Yeah, you know, we've, at the NAMI office, even we've seen numbers of our call line, our helpline, increase with people with gambling problems. And what it is mental health associated with the gambling increase, depression, anxiety, jail arrest, because what they're doing, you know, they're trying to offset the losses by illegal means, which is stealing or whatever.
There's no one would question that there are some benefits. I think in February alone, almost $33 million in tax revenue from wagering in Arkansas. And as we mentioned up top, you know, there are some jobs created, and the casinos, the wagering establishment, they need vendors, and all of that generates tax revenue. But there's an economic downside too. Can we measure, have we been able to measure that? Are there any measures of it so far?
We are working on that right now with the Arkansas Problem Gambling Council, and also partnerships with local colleges and universities from social service programs to be able to create needs assessments for social impacts for risk.
Well, you know, I think as far as the needs assessment, you know, a good determination for us is, in my clinic, I'm seeing more people come in with gambling as the problem. And then the secondary problem is the depression or some other, mental health issue that's going because of their debt that they're in now.
How does gambling work on the psyche? I mean, the neurons, if you will.
Yeah, well, it's kind of like, I've said this before, and we talked about it a little earlier before the show started, is that, it's like when you take that first drink, that first alcoholic drink, and it clicks, the brain, it likes it. It feels good. It makes you feel happy. It sets all the neurons and everything's firing up there that's supposed to be firing to make you happy. And then you go into the casinos, and it's, lights and sounds and the smells and everything that goes along with that. The brain is receiving that as a pleasure sensor until you go home and realize that your $2,000 paycheck is now, you left it at the casino.
Right. And
then you still got rent and, electric bills and whatever else to pay.
Well, the casinos are, of course, the nexus of online gambling in our state. It's filtered through or routed anyway through the casinos. And I suppose we should credit the casinos for their contributions to national organizations for problem gamblers. We talked about how your inquiries were up 20%. Can we put that into numbers?
We can put that into numbers. So
you mentioned 800, I think.
800 or so. Last year, we saw a total of about almost 5,700 calls, and we expect that to increase another 10 to 15% for this year. What I am seeing is a different level of call servicing for us. People are asking more in-depth questions for not only for themselves but also loved ones. And so as the Problem Gambling Council, we hope to have therapists and counselors ready for both parties, for the gambler and for the loved one.
Well, I was going to ask, the inquiries that you get, the calls that you get, are they mostly from the gamblers themselves or from significant others?
They're mostly from the gamblers themselves, most of them. But we have seen an uptick in calls from the spouses or other loved ones in the family as well.
Your phone rings and it's a problem gambler, and he or she says what?
They say, "Hi, can I get help? What can I do? I've lost it all, or we're about to lose it all." And not only calls, there are also text. We have a text information chat line that's available, and they can send a confidential email to us directly. And sometimes we get those that have lost it all, and then we also have a referral system with Dr. Lackey and with NAMI, because you can see with the assessment or screening that there's some underlying depression or some other comorbidities, as we call it.
Right.
But in the clinic side, it's kind of like I see just almost the opposite. I usually get the family in first because they're trying to figure out how to help their son, daughter, husband, wife, whatever. And right now I've got a lady that she's coming in to seek therapy because she's depressed and she has anxiety over stressing over the third of the month. What's the third of the month? That's when her daughter gets her once a month paycheck. And it's a hefty paycheck. She's got a very good job. But by the 7th of the month, she's already gone through almost $15,000 of her salary that she's got. And then, grandma buys the child a pair of Nike shoes, and all of a sudden, we lost them at the school. We don't have them no more. So now grandma's trying to figure out where's all the stuff I'm buying going. Well, now she's figured it out. It's being hawked or sold, marketplace, online, they're selling the stuff.
It is, I think, a widespread assumption that wagering problems, gambling problems, typically are found in the lower socioeconomic category. Is it, in your experience, does it cut across demographic lines to an extent far beyond that stereotype? The gambling problem doesn't know a political party. It doesn't know a social economic side. It doesn't know a race. It doesn't know a class. It's everywhere. It's all across. I've got patients that I see that, make barely minimum wage, and I got some that make more than all three of us put together in the room. And it's a habit. It's addictive. They like it. Until they
leave and realize that they're leaving their whole check there. And I think that's where it becomes a problem. But now this grandmother, this mom, has got to get her daughter to convince it's a problem.
Online wagering, has that aggravated the problem? Has it made?
Well,
it's given you more clients anyway.
It has, and it also has given increased accessibility to where everyone with a cell phone has a walking 24/7 casino in their pocket.
You got a slot machine in your.
Right.
Well, just look at college students. You know, it has jumped through the roof on the college students that are now in debt because of their online gambling. And in fact, we have found that as young as 12 years of age is now proficient.
12
is now proficient.
You said
in
12
gambling.
years
I said 12.
old. Okay.
Not even a teenager yet. And they are very proficient in the games, online games. And in fact, we talked to one lady that called into the office, and the casino, they already got a marker or something that this child owes. So it's like, how do you deal with that? You know, and when they try to reach out well, I've got another client that's an executive at a large company, and we sent her to a 30-day treatment program out of state, and then she come back, and she was working on getting going out to the casinos and saying, hey, block me.
Self-exclusion.
Yeah, self-exclusion. Sorry, I couldn't remember the name of that. But so now they tell her, oh, you got to come here to do that. Mm-hmm. And she said, I don't want to go there because I know if I walk in, I'm not going to self-exclude. I want to spend my check.
Right. Yeah.
Is there a treatment protocol? How do you go about helping somebody?
So there is a treatment protocol. The first step is to ask for help. And with that, again, they can always, a client or loved one can call the 1-800 helpline number that's available 24/7. And from there, they will have a friendly voice like myself or another person trained on the line to be able to answer for them.
Got a graphic up now with that number.
Yes. And from that, they will also be referred to someone like Dr. Lackey's office with NAMI or another counseling service that can provide them individual counseling services or group counseling services in an outpatient setting.
Your organization is budgeted at about $200,000 a year. What can you do with that?
Well, had to get very creative with the budget that we have so far. We are working on several initiatives to work with several different populations, whether it's the youth or college-age students. There's also working and training other counselors to be able to take the calls and to handle the processing for counseling services. And then also to create that awareness and from advertisements for the public use so they could see that there's help available.
Warning signs?
Well, I mean, the first is, when you can't stay away, that's the first sign. I mean, and then, we have can't pay your bills, money's missing, we can't explain where it's going. And it's kind of like if you look at an addict as like an alcohol or drug abuse, you got the same signs, missing money, missing time, missing work. And these are just kind of the same signs that we have over into the gambling addiction.
Because this is an addiction. I mean, it's liquor, it's drugs, it works in the same way.
Yeah, the same parts of our brain that set off when you use drugs or alcohol, it's the same. It makes you feel happy when you're doing these things. It makes you feel happy when you're down at the casino and you're getting all the free stuff that they're giving away and chances to enter trucks and cars and
purses and jewelry and all kind of things. And it's also, I always say to our clients, it's a sign for a loss of time with family, a loss of time from work. Some persons that I know, clients that we've had before, they can stay for hours, right? And whether it's on location at the actual facility, location, casino, betting place, or it's just on their phone.
got to end it there because we're out of time. Dr. Lackey, Vena, Schexnayder, thanks so much for your contributions. Come back soon.
Thank you.
Thank you.
Thank you, and good luck. As always, thank you for watching. See you next week.
Support for Arkansas Week provided by the Arkansas Democrat Gazette, the Arkansas Times, and KUAR FM 89.